I'm Congresswoman Donna Christensen. I represent one of the territories of the United States, the U.S. Virgin Islands, and I'm a physician by training. I practiced for 21 years as a family physician. Originally wanted to go into adolescent medicine, so the issues that affect especially teenagers and young adults, as we're going to discuss here and as they transition out of foster care, is something that's important. I've also done at the Congressional Caucus's annual meeting sessions on foster care and on early childhood brain development and the importance of the nurturing of the young child. So those are issues that we're going to be discussing here, which I've long been interested in. And of course, you know, every community has its challenges, and we have a relatively high poverty rate. We have a foster care system that probably could use some help, and I'm really interested in hearing some of the best practices that we're going to be discussing today, and talking to some of the students, the fellows who have transitioned out, and the program that has been assisting them at a very, very difficult time for foster children.
What's the system like in the Virgin Islands? I mean, is it administered by the federal government? Yeah. Or how does it, I mean, I'm not familiar.
Yes, we territories get limited funding compared to the states. So we're small too, but still our funding is generally capped. It's not necessarily related to our population size. But it's funded by the federal government primarily, and the local government, of course, kicks in, and we have some not-for-profits. Annie Casey is active in the Virgin Islands as well, with our Virgin Islands Community Foundation. So it's pretty much like you would see in the States, and the challenges are also pretty much what you see in the States.
What do you think about your colleague, Representative Bass, pulling together this listening tour and kind of the breadth of folks involved in this delegation? I mean, it seems to me a pretty serious undertaking in the surrounding the issue of foster care. So what's your impression?
Well, I think it's great. You know, it's the issue of foster children and the whole child welfare system in the country and in the different states is sometimes off the radar screen, and it's critically important that we put some focus on it. In different states you read about the failures of the system. Here we're going around and looking at what people are developing, the creative ways people are trying to address some of the very same challenging situations that are not being addressed as well in other places. So I think it's very, very important, and I really look forward to having a listening session in my own district.
Okay, we'll come to that one. That sounds like a good one to come to.
Yeah.
And just the last kind of ideas, to what degree do you think this really has an impact on the kind of policy decisions and the decisions that happen in Washington, D.C.?
I'd run the health task force, the health brain trust for the Congressional Caucus, and we do listening sessions as well. They are really, it's very important for us to go out of Washington and go into the communities where, as the commissioner said, the rubber meets the road, and hear what the challenges are. And it does help us to go back to Washington and use what we've learned, either about the challenges themselves or how those challenges are being addressed as we go back to shape policy for the country.